we are going to talk about eye health with Dr. Neil Sharma, who we've had in the studio before. And we're going to talk about ocular melanoma, among many other topics. But this is an opportunity for you to get a little bit of free advice from our specialist, Dr. Neil Sharma. Now, the last time we had him here, the phones went berserk. He won't be here forever. So the tip is to get in early. Maybe there's something about your own eyes or eyes, the eyes of your family members that you'd like to ask a question about. Maybe something to do with your prescription, maybe something to do with something that's occurred in recent times and some vision problems you've got. Well, Dr. Neil Sharma can attempt to answer your questions on 131873. So jump in as quick as you can, 131873. He's from Eye and Retina Specialist, Dr. Neil Sharma. Neil, thank you very much for coming in.
Great. Thanks very much for having me, Chris.
Good to see you again. Last time you came in here, it went absolutely into meltdown mode, our open line. So hopefully as soon as we get our callers, we'll get straight to you. I couldn't believe that you can get melanoma of the eye. Australia has one of the highest rates of melanoma in the world, and apparently it's the same for ocular melanoma.
That's absolutely right, Chris. It's something that's less well known in the general community, but certainly melanoma can affect inside the eye, the middle wall of the eyeball itself, what we call the choroid or the uvea, can develop melanoma just like any other part of the body, and it can be a potentially fatal condition.
And does it come up in any kind of eye test? Does it come up automatically?
It doesn't come up automatically. It needs a comprehensive, dilated examination to find it in most cases. So often people have some blurred vision or may indeed even be asymptomatic in the early stages and not know there's anything wrong. So I suppose from my point of view, it just is a good encouragement to remind everyone to get their eyes checked at least once every year, especially once they're over the age of 40 by their optometrist, and they should be screened and checked and hopefully picked up, any nasty things such as that or other eye problems.
See, when I think of melanoma and I think of skin melanoma, I think, maybe a mole that's gone bad. Do you actually get moles in your eyes?
You absolutely do, Chris. And right. Moles at the back of the eye are quite common, in fact. Often, as a retinal specialist, I get referred patients who the optometrist picked up and just want to double-check to make sure there's no melanoma-like features to it. The difficulty when it's at the back of your eye is that patients can't look or monitor it themselves. I mean, we all know that if you have a mole on your skin, if it gets bigger or starts to bleed or changes colour or shape, to get it checked out. Whereas when it's at the back of your eye, you really need someone who can visualise the retina to be keeping a watch on it. So they are much more common, just simple moles, but it's picking up and detecting the melanomas or melanoma potential that is really the important part.
All right. As I mentioned, Dr. Neil Sharma comes to us courtesy of Eye and Retina Specialists. You can go to their website, Eye and Retina, eyeandretina.com.au. Let's go to callers. Claire, Neil is listening. Go right ahead.
Hello. I'm inquiring about Charles Bonnet syndrome. I have glaucoma and MD, macular disease, and I'm legally blind. But I have Charles Bonnet been diagnosed probably 3 to 4 years ago, but it's really bothering me this last 4 days, really bothering me. I'm ready to run away, but it'll come with me.
Right. Claire, I'm really glad you've raised Charles Bonnet because it's something that's not really very well known in the community, and I'm on the Public Health Committee for the College of Ophthalmologists, and we put out a position statement on Charles Bonnet syndrome last year, which is one of the first in the world to do that. Essentially, for those who aren't aware, Charles Bonnet is a syndrome that affects people who have poor vision in one but usually both eyes from whatever reason, and macular degeneration is the most common reason, but as you say, glaucoma or other things can cause it as well. Now, in Charles Bonnet, patients will get very clear formed visual hallucinations that is due to the optic nerves playing tricks on the mind rather than there being any sort of mental illness or anything like that. And the problem is it often affects elderly patients or elderly people who are scared to tell their carers or their friends or their relatives that they might suddenly start seeing people walking around who they know aren't real, or they might see plants or trees or gardens and so forth. And so the important thing, first and foremost, is to get awareness of the syndrome, that it's not you going crazy, or it's not you imagining things that means you're getting delirium or so forth. It's a brain being played tricks on by the eye, there's a Charles Bonnet Foundation which supports patients such as yourself, and it's often just a matter of the GP and the carers and relatives being aware of what it is and not, worrying that mum or grandma's going a bit crazy, but it's just the eyes playing tricks on their mind, and that there's no underlying cause necessarily in terms of mental illness or anything like that.
So maybe she needs to go back to the GP.
Go back to the GP or talk to her ophthalmologist about it. But as I said, there is a support network, and other patients who have it often find it useful to talk to other people with a very similar condition. So good luck with it, Claire, because it is something that's important to recognise.
From Claire, we go to Mark. Go ahead, Mark.
Good afternoon.
Hi.
Yeah, look, I just want to know, I've just been recently, I had my regular eye checkup, and I've just been diagnosed with the very early signs of macular degeneration. Now, I've been prescribed to use tablets called MacuVision Plus. I was just wondering if you have any other suggestions that I can take, and what's the prognosis, I guess?
Again, a very topical issue you've raised, Mark, because, again, the College of Ophthalmologists have put out, as part of the Choosing Wisely campaign, a position statement on macular degeneration supplements just in the last couple of weeks. And essentially, there is no evidence to say if you have no macular degeneration or very early macular degeneration that taking those supplements is of any benefit. And I know a lot of patients are prescribed it, and it often is a reasonable financial burden to carry as well. The advice from the College of Ophthalmologists based on the evidence is to say healthy diet, green leafy vegetables, fish a couple of times a week, avoiding smoking and so forth is the way to go. For patients who have more advanced disease, then MacuVision may be of benefit in some cases, but it's certainly not something that universally has been proven. And so, like anything, it's a matter of weighing it up in each individual person. So, in terms of prognosis, I suppose what we don't have yet is a treatment for early macular degeneration. There are things that are being worked on worldwide, in particular in Melbourne, a laser treatment that's being developed by an Australian laser manufacturer shows some quite good promise to get rid of early drusen and to shrink them away. And the major results of that study will be hopefully, released later this year. But certainly it is showing promise.
Okay, 17-3. Thanks. Colleen, go right ahead.
Dr. Sharma, I 2.5 years ago had my right eye removed because of melanoma. I was diagnosed with a melanoma behind my left eye too, but it wasn't malignant at the time, but in the last 3 weeks I can't sleep at night with severe headaches above the left eye. They settle down in the day, but I just don't know if it's just the tension. It's as if the right eye's draining.
I must say, Colin, I'll just interrupt for a moment. I mean, if you've had a previous melanoma in the other eye, I must say it does make me a little bit nervous or anxious if you're having any symptoms whatsoever in the left eye, or even headaches or so forth that are new onset. My advice in those sort of situations would be to get it seen ASAP, if you know what I mean, either through the optometrist firstly or the GP, and then off to a specialist sooner rather than later, because it's not the sort of thing that you'd want to leave, and especially if it's your only good eye or your only eye at all.
No, I'm not coping with it, but I put it off, so I'll have to go back to the optometrist, to the eye specialist, I suppose, and see.
Correct. When it's your only eye, in particular, you've just got to do everything to look after it. And so my advice would be, sooner, as soon as you can, really, either through your GP, optometrist or specialist, get it looked at and addressed as soon as possible.
Thank you very much, Dr.
And it's a pleasure.
Thanks.
Good on you, Colleen. Appreciate all of that. 131873. Let's go to Elaine, if we can. Elaine, go ahead.
Oh, good afternoon.
Good afternoon.
I've got a floater, and I've been to a specialist, and she examined my eyes, all the back there, and that's all it is. There's nothing wrong actually with the eye, but it's annoying. But I've got a dreadful headache. Would that floater cause a headache? I can't seem to focus with it going backwards and forwards in front of my eye.
Generally not is the answer. I mean, floaters are a very common...
What are they?
Floaters are a condensation in the jelly or the vitreous cavity of the eye, and they typically occur as patients get into their 50s or 60s. As part of the normal aging process, the jelly separates from the back of the eye, and as it does so, it collapses down, and often that can be associated with bright flashing lights or sudden onset of new floaters. I must say I probably see 10 to 20 patients a week with what we call a PVD or a vitreous detachment. Mm-hmm. That's part of the ageing process. What we look for is to make sure there's no hole or tear in the retina, which can cause a retinal detachment, which is a major ophthalmic emergency, and so it does need to be checked. If you have a single floater, generally after a couple of weeks to months, the brain adapts and gets used to them, and we generally advise no treatment is necessary. But I do have the occasional patient who have a single spot that is really bothersome, and there is a new laser that has just recently been developed to, in effect, zap those, but it is still in the early stages, and I must admit it's not something that I generally recommend until the technology is sort of further elucidated, but some people do find it of some benefit. Does that answer your question, or is there...
Yes, it does, because my GP sent me within the hour straight over to the eye specialist.
Correct.
And I've been thoroughly examined, but it's just this headache, so it might be the flu or a cold, or I have got a bit of sinus, so it's probably that.
It may be unrelated, but like I said, give it a couple of weeks, but if it's still there, go back to the GP and just sort of get it looked into a bit further, then I'd recommend.
Okay, Elaine, thank you very much for your call. Val, we can get you in as well. Neil is listening.
Yes, hello, Doctor and Chris. Look, in 2012 I had both eyes, cataracts removed from both eyes. My right eye was fabulous. My left eye has never been right since having that done. I went back to the specialist 6 months after having the left eye done. I went back to him and told him it was as if there was smearing there. I was wiping my eye all the time. He told me to wait 6 months and he would laser it. He did that. Still, my eye is not right. And I've just been back to my optometrist and he's told me that there is a film, but he'd like me growing again, but he would like me to wait. Is this going to be an ongoing thing, this lasering business?
To be completely honest, normally when you've had cataract surgery, probably about 10 to 15% of patients can develop a film or a little fine membrane over the back surface of the acrylic lens. We insert the intraocular lens, and usually that is treatable with a single laser treatment, what we call a YAG laser. It's the sort of procedure that you tend to do one time, and once it's done, there's no scaffolding or nowhere for the membrane to regrow. So it almost always is a one-off treatment. So I must admit it is a little bit unusual for that to be growing again.
My eye is quite blurred, when I'm looking, and sometimes I see sort of double vision out of that eye, but the optometrist tells me if I can wait some months down the track, I'll go back to the specialist and he can remove this again. I'm just concerned that this is going to be something that I'm stuck with for the rest of my days.
I suppose it's difficult sort of without seeing you to sort of give definite advice. There are a number of other causes of blurred vision after cataract surgery, some of which are treatable, or some people, if they've got macular degeneration or other causes, there's a limit. So generally what I would advise is, either see the specialist or see someone, for alternative opinion if you would like. But at the end of the day, the YAG laser you can do as a one-off generally. So I don't think you'd be going in for repeatedly for that procedure, but it could be something else that needs to be addressed.
Okay, we've run out of time. You have been bombarded by our listeners. Unbelievable. And we went across a whole cross-section of topics today, which was really handy for people listening.
Yeah, no, as you know, eye disease is something that is very common, unfortunately, in the population, and generally in my social life and as well as professional life, there's always lots of questions, and happy to give advice wherever possible.
Thank you very much for coming in, Neil. Fantastic to have you here. Dr. Neil Sharma from Eye and Retina Specialists. Just go to the website eyeandretina.com.au, or it's 9699 0001, 9699 0001. We've got a verdict